Hi friends, I'm Sudha sir. I'm going to give you a lecture on schizophrenia. You know that what is schizophrenia? Schizophrenia is a mental disorder is there in which patient is there is unable to think, unable to talk. He always have a fear with uh, he is always have a fear with different type of the peoples in the surrounding of them. We can say that his or her family member also he is unable to concentrate, he is unable to plan. Then he when the situation is there is worse, these members are there that are have a fear or they are have frightened the his or her shadow also. This mental disorder is there in the such type of the patient which can interrupt the reality. When there is a combination of the hallucination is there, then decision making powers are there, then extremely disorders thinking is there, means somewhere the disastrous thinking is there, that is also found in such type of the patient, and because of which the behavior is there is also occur in such type of the patient. We can say that the abnormal behavior. In most of the film, you have to be observed that the patient is having a shock, so he is frightened. There is somewhat no reasons are there, or because of the accidents are there, or some of the things are there that is to be occurred, and because of which patients goes into the schizophrenic condition. Repeatedly watching of the horror movies also that creates such type of the incidents in your life that you becomes a schizophrenic, because at the time you have to be observe this one film, or at night also you are along with your friends, so there is no fear. But when you are alone or walk alone in the particular street, so you always have a fear of someone if there is following you, and repeatedly you have to be rewalk this one, that is a schizophrenic. And nowadays whenever anyone mobile is there is to ring, you also think that my mobile ring is there is to be ringing, or you repeatedly watch your mobile. This is a type of the somewhat schizophrenic conditions is there. Now, in this case, we see that the different examples are there that indicate that patients are there that are schizophrenic. Now, this is the one. The person is having a fear of his shadow also. Here, in a one corner, he is sitting and he is trying to protect himself from that one particular shadow. This is the second one. This lady is there. She is sitting lonely. He is having somewhat aggressive in nature. If someone comes to the, he is going to attack on such type of the persons if there such type of the behavior is there. This one lady there is also sitting in the corner, and she is going to protect from his sorry, from her family member. Okay, this is the whenever the mind is there, it should be disturbed, brain is there, it should be in a disturbed position, then such type of the problems are there that are to be found, that is you are unable to think properly, and such conditions are there that are appear. This is the severity of this one. Same one is there, that is the 2 to 3 minds are there that are speaking with each other. Such condition is there, it should be appear, that is a schizophrenic conditions is there. Here this person is there, should be sitting lonely, means patients also think that no one is there, is to be with them, because they know that they are suffer by the schizophrenia condition. So to protect others, this patient try to sit lonely, and they are involved in their own life. This condition is there is known as a hallucination condition. Means patient is there is will live in his own world. That is a hallucination condition is there. Okay, these are nothing but your psychosis is there, or the schizophrenia is there. Now, general view of this one is there, that is psychosis. Psychos, we ultimately saying that are you psycho? Then means a severe psychiatric illness is there, the mental illness is there, is we found with the serious disturbances in that patient. He is unable to thought properly, he is unable to behave normally, his capacity to recognize the reality and the perception is less, or the there is a disturbances is there in the what is the reality. This such type of the patient is there, it should be rather than believing on their own family member, they have to believe on the others. Sometime if they have somewhat they are going to kill them, or likewise thinkings are there that should happen, someone the plans are there that are made against such patient, so they have to believe on their neighbors rather than the family member. He cannot pursue his family member what is the real condition is there. The perception power there is lack, and the condition in there is known as a psychos. Schizophrenia is nothing but a schizophrenia is a particular type of the psychosis. This is what type of the psychosis is there, that is a mental disorder that is usually caused by some irritated dysfunctions of the brain. Means from the hereditary, the disease is to be transferred from one generation to the another generation, and because of that, some of the mental disturbances are there, or we can say that mental illness is found. That is a condition that is a schizophrenia. Now the next one is there, that is a prevalence. The schizophrenia occurs with a regular frequency near about 1% of the total population is there that should be suffer by this one schizophrenia, and this schizophrenia is mostly occur in the age of 16 to 25 years, and that is mostly seen in the males as well as the women also. It is not like that the males are more suffer than the female, or the females are more suffer than the males. Depends on that what situations are there, the peoples are there that are sufferer also. The schizophrenia is leads to a group of the characteristic positive and the negative symptoms. Means in this schizophrenia, just like we seen that in the first one, that patient is there is sitting in his own world. That is the he is not going to harm anyone. That we call it as a some positive symptoms are there. But here he is going that he is going to frighten, and he is going to attack if they becomes towards her in this one particular condition. That is a negative symptoms are there, means somewhat disastrous thinkings are there that she found, that is known as the negative symptoms. Then deterioration in the social, then occupational, as well as the interpersonal relationship. Social means such type of the persons are there that are not goes into the social community or for the social work, because they know that they are schizophrenic. So what are the others are there that are thinking regarding him or her, then how to behave with such type of the persons, what they ask, why the, such type of the conditions are occurring. uh, by taking the care we are going to ask him, so in that case they are frightened, so that they avoid the social relationship. Then occupational, they are unable to go in the occupation, means somewhere they are going to give the speech, or some of the functions are there, or in a service they are unable to perform the task also. Then interpersonal relationship in the family members also, if one person is suffered by this one schizophrenia, if he came to know that that is a schizophrenic, then he is going live lonely, he is not mixed up with each other. These things are there, that is the interpersonal relationship. Continuous signs of the disturbances for at least 6 months, that is will remain for this one if the treatment is there is not to be taken. The primary symptoms of the schizophrenia is there is nothing but is a mania. Mania is nothing but it is hyperactivity, uncontrolled thought, then speech may be associated with the violent behavior. In such type of the mania condition, patient is aggressive one. On a small thing condition also he become more aggressive. If the volume of the TV or the radio or the is there, should rise, he shouted loudly, and he's try to control all these things, just measure something there should be happen. Likewise the uncontrolled thoughts are there. He always think that he is such peoples are there that are going to torture him, so that they are going to increase the volume, or they are laughing, or they are making the somewhat some things which irritates patients, just like that. So such type of the thoughts are there that are to be found in these people's. Then their speech is there is also associated with the violent behavior. some aggressively or the shouted loudly speaking, such type of the things are there that is will happen. That is nothing but is a mania is there. Now, next one is there, that is the depression, the sadness because of the mania. When the patient is there should be calm. After that, he feels sadness. Then he feels guilty. Sometimes he accept that situation. Sometimes he can't accept this one. Then physical as well, the mental slowing. What is the reply to this one is somewhat slow. He is not going to give a reply to the particular situation, that is a mental slowing. Then self-destructive ideations are there, means to keep him alone from their others, he is going to keep in a particular room, he is going to lock this one room, he is not going to mix up with each other. If he think that someone is the on, he is not able to attack on the others, such as the family members are there or the relatives are there, then himself or herself he is going to attack, so that he think that he or she get protected. Such type of the depressions are there, and such type of the ideas are there that are to becomes in such patients mind. And this is of the two types are there, that is a manic and the depressive one, mean both the situations are there that are found in this one patient, or sometime that is a unipolar, either the mania or the depression things are there that are found in such patient. Now, schizophrenia is having the four symptom, that is a positive symptom, negative symptoms, then cognition is there, and the mood symptoms are the positive symptom, that is nothing but hallucination. Means patient is there is sitting in a alone, alone in a room. He is not going to attack someone. He is a delicious one. Means such type of the patient, though the all everything there is normal, he is unable to think that the conditions are there that are normal. He always think that somewhat problems are there. Then deorganized thoughts are there, because of which some of the thoughts are there in mind. Why this is to be happen? Why not like this? If there is to be happen, he is not going to be satisfied with that one particular plan or what are the work which is going on. Then perception disturbances, he is unable to find out this what is the wrong and what is the right one, though all these conditions are there that is we appears properly, but he is not able to pursue this one. He think that there is a somewhat disasters, or the management is not a good one, or the so he try to correct this one. Likewise the thinking are there that should happen, that is a perception disturbances are there, the inappropriate emotions are there. In this case, the emotion conditions are there that are not proper to control this one situation, that is a positive symptoms are there. But we call this one positive symptom because in this case, patient is there is not going to attack on any others. So in this case, we called it as a positive symptoms are there. Negative symptoms is nothing but is a blunted emotion, means there is no sharp end point or there is no conclusion by talking with such type of the patients are there. If he or she there is somewhat having intellectual one, and if you are going to take some more decision, then he is not going to give the proper conclusion that you have to perform this or not to perform this. Most of the people are there in our life daily life also, we found that they are not having a conclusion. As the water flows toward the downward direction, likewise the people are there that are going to give the decisions, means they are not having their own decision, but depend on the situation they are going to give the decisions. Then adonia, that is the inability to feel pleasure in the normal pleasurable activity. What is the activity which ought to be going on smoothly, he is not to be happy with this one condition. Now there is a lack of the feelings also, means in this case sometimes this patient may attack because they don't know what is going to be happen, which type of the injury there occurs. Likewise sometimes they are snatch scratch by their nails also on the family members. So these people are there that is not having the feelings what are there that is we occur. Then cognition is there, that's a new learning, or we can say that memory is there. Cognition means these patients is there, they have somewhat different thinking, which are somewhat new one, which is not a regular one. They can fly in a year without having the mm, wings. Likewise, the thinkings are there. They can move from one place to the another place, or jump uh, from one place to the another place, just like the cartoons which are shown in the televisions. Likewise, they are trying to do. And the memory there is not giving the support to this one patient. Then next one is there, that's a mood symptoms are there. Loss of the motivations are there, means such type of the patients are there that are not giving the motivation, just you have to do, you have done right, just you have to continue, fuck up. Likewise, the things are there that we have to be regularly said, or the normal person appreciate the efforts which are to be taken, though there is no success, but they have to appreciate and ask them, just we have to continue the same one task along with the somewhat hard work. But such type of the things are there that is not to be happen in case of the psychic patient. Social withdrawals are there, means such type of the patients are there that are not involved in the any type of the social activity, or sometimes they think that why we should do, if the all the family members are there that are also involved in the such type of the activity, they are also needy. Likewise, the things are there that are to be thinking. Then demoralization is there, or sometimes they have think to suicide. Likewise, the things are there that are happen in case of the schizophrenia. The positive symptoms, that is a hallucination, are there. I think a person sees or hears, smell or feel that no one else can see, hear, smell or feel. Just like that, the normal person is involved in the very type of the activity, so that he is not having that type of the perceptions, but these persons have some special character. They have hear, they can see, uh, some type of the images are there, which are to be observed in this case. Just like in case of the films also, we see that the monsters are there that is be observed by this type of the peoples in the night, or in the with the family member, but other members are there that are not able to see, but only this psychic patient can see. There is a monster either she be present in a room, or they even even to the shadow. These peoples are there that are frightened. Sometimes they have special smell if there is found in such type of the patient. Then voice, the most common type of the hallucination in the schizophrenia is nothing but is the voice. This type of the people hear some noise or voice at the night time. Even though regular students, or we can regular people are there that are unable to listen this voice, uh, but these people may observe such type of the voices. The voice may talk to the persons about his or her behavior, means along with the voice, how they are to be talk. Some if some people are there that are talking with each other, they see such type of the people or patients always think that they are talking regarding their behavior. Then order the person to do things, so that in this one they have loudly asked to the another people, just there to bring something, or to ask them just to do they order them, or sometimes warn the person of the danger. Sometimes the voice talk to each other if there is appears. The other type of the hallucinations are there. Other type of the hallucination include the seeing the peoples or the objects that are not there, then smelling odor that no one else detect, feeling things like the invisible figures, fingers touching their bodies when no one is there is to happen. In most of the horror films, you have to be always such type of the patients are there. If the monster is there, that becomes and they try to touch such type of the patients that are to be shown. They are having some type of the smell where nothing is there is to be found. They show somewhat trying to smell particular odor, whereas the another one is there is not getting or not feeling such type of the things are there that is we happen. That is a positive symptoms of the hallucinations. Then next one is there that is a delicious. We can say in Marathi that is known as a Brahm. Okay, means patient is there is having a ability to fit on the different things rather than their own. Delicious are the false belief, or we can say that faith. The person believes delicious even after the one people prove that these beliefs are not true or the logical. If the family members are there that are asking that this is not true, this may worsen or they may create a problem. But in that case, the psychic patient that show they why not they have to think like what they and he or she is going to perform which is not as per the proper manner. People with schizophrenia can have delicious that seems the strange, such as the believing that the neighbors can control their behavior with magnetic waves. Means such about the patients is having somewhat much more faith on the neighbors rather than the family member. She or she think that the family member is there is going to plan against him. They somewhat harm is there that she occur because of the family member. In this case, the neighbors are going to protect themselves so that such type of the condition is there is occur that is nothing but is a delicious. Then we also believe that the peoples on the television are directing a special message to them. Means someone heroes are there which are to be found in the film and they give a message. They always think that these persons are there that are coming on the television and they are going to message for them only. Such type of the thinkings are there that is we comes and they love them and they have to behave just like that. Means most of more of the peoples are there that are having to mimic the various film stars are there just like Amitabh Bachchans are there, Shah Rukh Khans are there, and they follow their this one situation. I am not to told you that the normal person is making the comedy, but these patients are there that are every time they are following in this situation. Means depends on that film star what he or she thinks, which type of the film star is there in their mind depends on that they are going to behave such like. They have many cannabis delicious. Means when they are having delicious they become mental in that conditions. We can say that in Marathi it is known as a brahmveda. Okay, psychic person who are having ability to faith on the neighbors but not on them. So in this condition he become or she become mental and believe that others are trying to harm them. Sometimes this condition may happen whenever the in a society or in a office, such type of the persons are there. Every time they are working with each other, but in these psychic conditions, uh, they such type of the peoples are thinking that others are there that are going to harm them, such as by cheating or harassing them, or sometimes poisoning or spraying on or the plotting against them or the people they care about. Means those people who are taking care about such type of the patient, such type of the patients are attacking on this patient who is going not patient but the family member who is going to take care of him or her. These beliefs are called that is a delicious or the persecutions, delicious of the persecutions. Now movement negative symptoms are there. In case of the negative symptoms that are to be associated with the disruptions of the normal emotion and the behavior. Means what is the normal behavior is there, how to walk, how to talk, how to show the expression, that things are there that is not happen, and the condition is there is known as a negative symptoms, or we can say that emotions are there. Most of the film such type of the scenes are there that is be shown by the directors in a film, that are about the negative behaviors are there. Means a group of the peoples are there that are to be talking something important one, and such type of the patient comes and they laugh, or someone dead sea there should be found in a home, and such type of the people comes laugh and dance. That is nothing but is a negative behaviors are there. They are not having the normal emotion as well as the behavior. These symptoms include the following: the flat effect. We can say that a person face does not move, or he or she talks in a dull or monotone voice, means a single tone or dull tone. They are going to talk. This type of the conditions are there that it should happen. Means in this condition they are not having any type of the feeling. They are speech in their own tone. Then lack of pleasure in everyday life, that is nothing but a hedonia is the one, that is the inability to feel pleasure in the normal pleasurable activity. What is the normal activities are there that are going on in this condition? They are not feel pleasure, or they are not feeling comfortable. What are the plans which are to be comfortable to the another one? That is a lack of pleasure in a everyday. Then lack of ability to begin and sustain the planned activity. They are not involved in any type of the activity, but if someone is there to plan, is going to perform this activity, they have a doubt why he is going to be performed. They are having somewhat meaning in this one, so he is going to plan. They are not accept the plans of such person who is going to work. And also if then we are going to ask such type of the patient, they are not going to give, then why should I give? No one is asking me. And if they give, that is not a perfect one. Like the such type of the conditions are there that is happening, speaking little even when forced to interact. If such type of the patients are there that are become, they are not happy, they are not having ability to begin or the sustain. If we ask him regarding the decisions, then in that case such type of the patients are there that are not going to speak anything or show any comments on these things. Movement disorder may appear as a agitated body movement. A person which with movement disorder may repeat certain motions so ever and over. In other extreme, a person may come catatonic. Means the repeated situations are there that should happen. Means repeatedly, one type of the sentence is there should be speak by such type of the persons, and they are not known what is going on. They only talk themselves only. Cognitive symptoms means in Marathi that is known as a ज्ञानाने अकलनीय होणे. Means in this case, this is somewhat like the negative symptoms. The cognitive symptoms may be difficult to recognize. It is very difficult because the patients are there. It's very difficult to judge. These are the patients are there. That is the psychic patients are there. Means by somewhat knowledge they are showing just like that they are the normal one, but actually not likewise this word. At the last or at the end of this one condition, they show somewhat different behavior, and that we know that they are these are the somewhat psychic patients are there. They are detected when other tests are there that are not that are performed. So general common tests are there that are fail in this patient, but special tests are there that we have to be performed in that test that detect that patients are there, that is a psychic one. Then ability to understand information and use it to make decision. And in this case some of the decisions are there that are to be taken properly. But in this case also, we found that what are the other persons are there that are not think properly. Sometimes miss 1% chances are there that are gives a proper decision by their activity, but not genuinely in troubles in paying attention. These people are there that are not hear properly, that are not listen properly, they are not going to concentrate uh, uh, on the two tasks if there or what we are going to perform. Even we are going to talk with them, they are show their normal abnormal behavior, they are going to play with their hands, with their legs, or they show here and there. Likewise, the things are there that should happen. That is a trouble in paying attention. The problems with working memory. Working memory is the ability to use the information immediately after learning it. Means what are the if someone asks them just to jump by jumping in a river or in a swimming tank, we are able to flow. They immediately jump, but they don't know how the swimming is there should done. They say jump, they directly jump in the swimming tank. That is the such about the conditions are there that should happen. That is the problems with the working memory is there. Then cognitive symptoms often make it hard to lead the normal life and even earn living conditions. Means because of the single situations are there, but because of this one psychic patient the situation may worsen. Means what the simple problem is there which is easily solved, the problem become much more complicated in a normal life also. They can cause great emotional distress. Means they always play have in a emotional condition, and they are disturbed one by the emotional thinking. So this indicate that patients are a psychic one. Here we see that where this patient is there just like a psychic one. He is thinking that where are those voice coming from. When you heard somewhat voice, he come to he, try to think that where the voice is there should be coming, how voice is there should be coming. I saw elephants under my bed. Means somewhat schizophrenic conditions are there that should be found themselves. Means elephants are there or lions are there that are found in the under the bed. Maybe I Jesus, just like they themselves they think that they are God or Jesus are there. uh, Then told me to free all the zoo animals. Likewise, the thinkings are there that should be found in their minds, and they always trying to contact. Means the normal persons are there that are not thinking, but such type of the thinkings are there that should be found in this patient because they are the psychic patients are there. So it's the right of them just to think different from the other normal, then that's why we are going to call them psychic person. Otherwise we are going to call them a normal person if they have to behave normally. So what the normal peoples are there that are unable to think, these psychic peoples are there that are thinking. Now I think this is the most wonderful in the developed countries are there. The situations if the someone is trying to develop or to do the somewhat strange thing, then what are the guidance of such type of the peoples are there that may be accepted by these peoples, and they have to do such uh, innovative thinking. So we can say that okay, they are following me. Means sometimes they always think that if they are to perform the somewhat task and someone is going to perform the same one task, such type of the peoples are there that are thinking they are following me. Just like that, 1 plus 1 is equal to 2. The normal person gives answer 2, and these people also gives the answer 2. If he gives the answer 2, then he think that the normal persons are there that are following me. Ultimately, the answer is same, but what is the thinking is there that is somewhat different. That is the psychic patients are there. The nature of the schizophrenia is there, that is the genetic predispositions are there, the genetic predisposition and the environmental or social factor or the psychological factor, when both are in the combination, that causes the abnormality in the development of the neurons and target features are there, because of which if the neurons are there that are to be developed abnormal, and because of which the target features are there that are not achieved, then what are the brains which are to be developed that shows somewhat dysfunction, then there's a a imbalance in case of the chemicals are there, such as the dopamine chemical that are mostly responsible, or some of the chemicals are there that is responsible. If there is a deficiency of such chemical, then that results in case of the schizophrenia, right? Then pathology of the schizophrenia, such as dopamine. I told you in the last slide that dopamine is most responsible for these conditions are there. Okay, there's a Carlson and Lindquist in 1963 that repeated administration of the stimulus like the amphetamine. Amphetamine is a stimulant agent, is there, then cocaine is also a stimulant. Now, most of the drinks are there, that is, the cocaines are there, that is be present uh, to stimulate, to have a stimulant action. But amphetamine and the cocaine, which enhances the central dopaminergic neurotransmission, means what is the dopaminergic neurotransmission level is there that should be enhanced or increased by amphetamine as well as the cocaine, then cause the psychosis that resembles the positive symptoms of the schizophrenia. Stress, a major predisposing factor in schizophrenia. Means stress is the major factor. If the patients are there that are having a stress, then patient is very difficult to revert from its or her situation. This disorder is more complex than the originally supposed, but it involves a combination of the genetics, or we can say that the abnormalities in amine neurotransmission. The neurotransmission, there is a difficulty in case of the neurotransmission is there, or the functions are there, that is because of the dopamine. If the dopaminergic level is decreased, because of which such type of the problems are occur. Then classification of the antipsychotic drugs are there. The main categories are there. That is a typical antipsychotic drug. That is a phenothiazine is there. There is chlorpromazine is there. Then chlorpheniazine is there. Then thioridazine is there. Then thioxanthines are there. Then butyrophenones are there, that is haloperidol or droperidol is there. Then atypical antipsychotic drugs are there, means typical and atypical. Typical means that are used for the special, and atypical for the generalized. Then in this case, clozapine is the one drug there. Then uh, risperidone is then olanzapine is the one drug is there which we use in case of this one treatments. Then next one classification is the difference between the typical and atypical. Antipsychotic is based on the incidence or extrapyramidal side effects, that is a less in the atypical groups, that comes in case of this one, that is efficacy in the treatment resistance group of the patient, efficacy against the negative symptoms are there that are to be found in this case. Now in this way, the this one chapter is there that should be completed, that is a psychotic disorder. Thank you.